All right, everyone, thank you so much for joining. We are going to go ahead and get started. Today is the last training for the cross-issue area application. This is the third part in our three-part series, webinar series, and we will be reviewing the sample application and narrative response checklist. But before we get started, we just want to do a quick recap of the part 1 and part 2 webinars that will be available, including this one tomorrow, via the key procedure and dates file, our procedure and key dates file found on our website, and we will be going there here in a little bit. But in part 1, we went over the history and background and the volunteer and staff roles throughout the process of what you can experience. We also then went through the policies and procedures and what specifically is eligibility and financial review documentation that would be needed. In part 2, we went through navigating the EC Impact web portal, which included registration and how you get your program signed up and what everything entails in the first part of pre-qualification and then submitting for the organization financial review. So today, the webinar content is really focused around understanding our hierarchy of language and also getting to go over the priorities and strategies within the investment areas. And then we'll go over the application and the narrative response checklist, which is a tool that was developed to help you put your best foot forward in the application cycle. So first things first, the hierarchy of language. We have a cross-issue area vision statement. So the cross-issue area, it adds a little bit of an extra level of the hierarchy if you're familiar with the hierarchy within our single issue areas. You now have to not only draw a connection from strategy to priority to vision statement within a single issue area, but now we're calling for you to also connect it back to the cross-issue area vision statement. So if I were applying within 2 issue areas, my job is to take my program, address both strategies, the priorities, the vision statements, and how I'm helping to achieve all of this, and how it ultimately connects to the vision statement of the cross-issue area funding opportunity, which is promoting holistic problem solving for our community's toughest challenges. So that is the vision statement that you have to address with the program that you are submitting for funding. So overviewing this investment strategy or the investment priorities, you can see that we do not have an estimated funding range for the cross-issue area opportunity. That is because our board did not want to assign a minimum or a maximum to this funding opportunity. So that means kind of all or nothing of the community fund is available to this area. As we've explained before, though, this is not something that you should be considering just because you think you'll have a better opportunity, because these funding recommendations or these programs will be considered first. It really is specifically for programs that cannot be split apart or strategies that cannot be split apart, because if so, then you would not be serving your target population in the best way possible. And so as we've described in our single issue area webinars, if we have $1 million to allocate and there's $200,000 worth of amazing cross issue area funding opportunities, the Vision Council will have to weigh whether or not they want to spend all $200,000. And if they decide they do, then $200,000 will come off the top, and then the $800,000 will be redistributed into the single issue area investment opportunities based on the estimated funding ranges. So who's the target population for this funding opportunity? That is based on the issue area guidelines. So you have to look within the strategic investment plans of basic needs, education, financial stability, and health, and braid those target populations together in order to properly apply for this cross-issue area opportunity. And then the same thing with our priorities. The priorities are already defined within the strategic investment plans. And so what I would do is read both of the requests for applications that you're trying to align with, or all of them, however many issue areas you're trying to braid together, and make sure that you really have a really clear picture of how these are working together. So we won't go into a whole lot of detail just because There's not a whole lot of time, but we will do a bit of a dive, not a deep dive, but a bit of a dive into each of the issue areas, so that way we are all on the same page with what we're talking about. One of the things that, even if you are applying under a cross issue area funding opportunity, you still have to comply with certain investment area stipulations. So for example, Basic Needs has said in their request for application and in their strategic investment plan that they want to see basic needs programs begin to make a plan for training staff and volunteers on trauma-informed practices. You can read more about why this is in the request for application, but if you are applying as part of, in basic needs as a part of your identification of the priorities and strategies you're addressing, then you must have a plan. You must start working on a plan for training staff and volunteers on trauma-informed practices. So Basic Needs has one priority and two strategies. The priority: supporting emergency services vital to the basic needs, food and shelter of the most vulnerable members of our community. For definitions and descriptions of what we mean by emergency food and shelter, you can go to the request for application. And then we have the strategies of individuals will have their emergency food needs met, and then individuals will have their emergency shelter and provision needs met, inclusive of, but not limited to, homelessness, safety from violence, and disaster. The investment area stipulations for education include being a part of the data collaborative, if that applies to your program. If you're an early childhood program, we will probably work with you to be part of a different collaborative. But if you're addressing K-5 and even 6 through 12, we do mandate that you participate in the education data collaborative. We also highly stress parent and community engagement, and for further information about that, please read the request for application and or visit the webinar number 3 for education. And then all programs should have completed the 10 baseline ACEs, Adverse Childhood Experiences, Toxic Stress BIST trainings created in partnership with Springfield Public Schools. This again is 100% a stipulation that must be met because you have 1 year to comply with getting your staff and volunteers trained on these 10 modules. So under education, our priority 1 has 2 strategies. Children enter kindergarten prepared with the skills needed to succeed. At-risk children have access to high-quality evidence-based home visiting experiences and interventions, and or high-quality evidence-based preschool experiences or preschool-like experiences. Basically, what we're trying to get to is rich, structured learning environments for our youngest children. For priority 2, we have children reach academic milestones on time and successfully transition to middle school. You still will have to address how your programs are helping children to successfully transition to middle school, as well as achieving academic milestones on time. But then within the first strategy, we have reading and math being measured. And in the second strategy, we do have social emotional development being measured, but you must also address attendance and or behavior as well. Priority 3 has 4 strategies: youth reach academic milestones on time, transition to high school, and develop a plan for life after high school. So with this, we really see the 2 strategies that we saw from the K-5 priority, which is at-risk youth will have supports to help them achieve on-time academically. But instead of reading and math, it is English and math at this level. And we also have at-risk youth will have supports to help them improve their social emotional development. Again, knowing that you can measure this with a social emotional tool, but you also must be tracking attendance and or behavior. And then at-risk youth will have a plan for life after high school and will achieve plan benchmarks. So this is, again, career mapping. Not saying that a 6th grader has to have the same career as they do when they start out in 6th grade, but they need to start having support to help them understand how do you reach a career goal by developing a plan. Number 1, setting a goal, developing a plan, and then meeting plan benchmarks. And then last but certainly not least, we have a strategy focused on our 11th and 12th graders to help them transition to life after high school. So whether that is going to college, starting a career through trades or apprentices, or joining the service, we want to ensure that no matter what, they have supports in place to help them make that transition. So if they want to go to college, we're going to make sure that they are there on the first day, because we're not going to let them fall off because they did not fill out their FAFSA, or they did not go to freshman orientation, or they missed a piece of paperwork. We want to have supports in place to help our students navigate whatever it is they are trying to achieve. So moving on to financial stability. And again, I'm going to repeat myself in the sense that you must read the request for applications within each of our areas in order to truly understand what we're asking for. This is just, we are diving into it, but it's not a deep dive. We're more so scratching the surface of these areas. So in order to properly grade your priorities and strategies together, you're going to want to have a full understanding of what they're looking for within each of the strategic investment plans. So financial stability really is, it's not so much investment area stipulations as it is definitions, but there's one issue, and that is that financial stability, you cannot be paying program participants wages through United Way funding. Now we do support and provide programmatic staff, but that is not wages of program participants. So we are not paying someone's paycheck aside from programmatic staff. I hope that that separation is clear. So with successful referrals, this is always externally focused and proof of connection must be available. So if I have someone within my program and I refer them to see a counselor, I'm going to ensure that they connected with the agency that might have housed the counselors available to them. But I don't necessarily have to prove that they have gone to sessions. It's really mostly about connecting to the location and having proof that that connection was made. Coaching, this definition, this is skills-based support. So this is a staff person or a volunteer training around a very specific skill. So whether that be conflict resolution or budgeting, this is someone, and it's only focused on that at that time. When we talk about case management, this is time spent typically done by a social worker or a case manager, and they are coordinating additional services and reviewing plan goals. So it's not specifically focused on one item at a time within that hour. It is focused on many things in order to help that person be successful. And then mentoring, this is time spent one-on-one between a trained volunteer and a client. And I just realized there. So priority one and strategy one, because there is only one. This is brand new, and this is really to support financial literacy through employment programs. So children are equipped with the skills needed to make financially smart decisions throughout their life. And the strategy to do that is high school students will have access to high quality evidence-based financial literacy and money management training as supported through employment programs. So in order to comply with this, you must, 100% must, be helping these students become employed, and through that, helping them with their financial literacy. It is not financial literacy without employment, and it is not employment without financial literacy. Priority two, this is focused on our working age adults, helping them to support themselves and or their families in a financially stable environment. Again, identifying what that financially stable environment is. And with these strategies, they name specific programmatic methods. And so they provide case management, coaching, mentoring. They do allow for opportunities for other identification of methods. But what we're trying to address is housing, safe and affordable housing of choice, employment, and or money management skills. And then we transition to our seniors at priority three. And these are individuals most likely on a fixed income. We do not have an age range for seniors. Programs must identify how they qualify individuals to be seniors. But what we do know is that we want them to lead independent lives. So that is looking at, again, we name specific programmatic methods, case management, coaching, mentoring. It can be others, but you just have to define those. And it is to help them sustain safe and affordable housing. And typically this is done by providing and helping them navigate additional resources to help keep them in their homes. So whether that's too much of their income is going to other things, so they help to provide additional services or coordinate additional services for the home, then that is what they do. And then the second one is around seniors effectively managing their money. And there's an element to this that is helping them plan for when they can no longer live independently, or if they can no longer manage their money independently from anyone else. And then health, last but certainly not least. If anyone applies trying to address health, they will have to utilize the United Way Client Health Survey if they are serving a population that has 13 and older individuals. So priority one and its two strategies are focused on changing communities. So individuals are supported, connected, and activated to lead healthy lives. So those are three critical elements that you must address if you are aligning with this priority and or one of the strategies or both. The first strategy is really talking about people walking the walk and talking the talk with the at-risk population. And so there are several key elements that they must address. We named some programmatic methods again, but you can look at addressing any others. But you must locate, activate, and support a targeted at-risk population. So first you have to name and define the targeted at-risk population, and then define how you're locating, activating, and supporting them. And then what are you locating, activating, and supporting them to do? That is to improve their access to care, follow through, social determinants of health, and ultimately health outcomes. And then the second strategy is pointed to really finding kind of synergistic centers of communities or health champions, or what we call stakeholders here, to locate, activate, and support a targeted at-risk population. So again, defining who that population is by providing the stakeholder with knowledge, skills, and resources to impact the people that surround them. We name specific examples of these strategies kind of playing out across the country and the effectiveness of those. And so please look at those if you are wondering if you fall here. Priority two and strategy one, because there is only one, individuals will have access to needed mental health services. So needed mental health services is critical, the needed part. And then at-risk underserved individuals will have access and increased engagement in needed mental health services. And then we do provide priority three and its strategy here, but most likely this will not apply because this is coordination of programs versus coordination of clients, and all the other priorities and strategies are coordination of clients. So United Way will advocate on behalf of health issues aligned with the selected priorities and strategies. So with our one grant that we're hoping to put towards this effort is to advance solutions to support mental health programs through the development of a community-wide system of care. So that is a mental health and or behavioral health system of care for our community. So that, again, scratch the surface of our priorities and strategies. And now we are going to locate the information we need for applying. So you can wait for the banner to change, or you can go to news and click request for applications now live, and then click here. And here's all of the information about all of the areas. So you can see we do have a request for application for the cross issue area opportunity, so make sure to read through that. But you also will want to read through the request for applications for each of the issue areas you're hoping to address. And then we have sample information for all of those areas. But diving in specifically to the cross issue area application, here's the application itself. And you can see it's pretty basic and standard and goes along well with all of the other areas as well. So you can start working on this now. If you want to, you can request the Word document version of this just by emailing myself or Mitch. We don't want you to wait until December 6th or 11th to start working on your narrative application. We're giving you plenty of time to start working on this, so we hope that you will take advantage of it. And then we have our sample narrative response checklist. Again, this tool was created to help you put your best foot forward in applying for the area of your choice, in this case, cross issue area. So when we are asking you to describe the program, we are asking you many questions versus just describe your program. And so in order to help navigate through that, we've given you kind of a mental checklist to help you understand, have I completely and adequately addressed this question for the Vision Councils? Here's our specific definition of collaboration. You will find this in many of our documents, but again, provided here for your convenience. One of the specific areas that I want you to be cognizant of is this issue area specific information. You can see we have several questions here. However, it does say consult each issue area's narrative response checklist for issue area specific information. So if I'm addressing education and another area, I want to go into education's sample narrative response checklist, go to issue area specific information, and navigate to the priority and the strategy that I am addressing. So that way I can include that appropriately within my cross-issue area application. We have our budget definitions. Please make sure how you're categorizing your costs in your budget do align with our definitions. And then last but certainly not least, we have our step-by-step demographic completion guide. So this will help you really make sure that you're filling this out appropriately and not missing anything, because there are checklists over here to help make sure that you do that. One of the questions that we're asked most often is, how do I know if I qualify for a cross-issue area opportunity? Well, there's a couple of things. So first off, what might be good is for you to start writing down or addressing the application and coming to one of the grant labs prior to the 22nd. So there would be two, on the 14th and the 21st. So again, every Thursday from 4 to 5, we're hosting grant labs here at United Way, and or will be available by phone. But put something in writing, and then we're able to respond to it. We can't just say, like, if your program calls up and says, like, well, Katrina, do you think this is a cross-issue area? Unfortunately, I'm going to have to say, I don't have anything to respond to. Technically, you need to put something down in writing so that way I can help, or I can see it more fully kind of thought out, because just in a general conversation, you're not going to be able to showcase enough of the detail that would allow for us to be able to help advise you in that situation. But again, that advisement is really to be taken as much as you want. We are not making or not voting on any of these programs. So you can choose to move forward in any which way that you feel is best for your program, despite any feedback that we may give you. Because we try not to really give advice, if you will, because that is too direct. Anyway, so the other way to think about it is, aside from putting some stuff in writing and then we can have a conversation about it, is if you cannot separate. So first off, you've identified this target population. You've identified how it's a tough challenge that you're trying to solve, and that problem solving, it has to be holistic in nature in order to solve this challenge. So if I have a program, say under health, but I know that, and it's geared towards children, but I know it has to have education as part of it, so reading and math or social emotional, and I'm tracking attendance and behavior as part of it, then, and I have to address their healthcare in order to affect their education, and I have to address their education to affect their healthcare, that most likely is there's a good chance that those two cannot be separated apart, and so it would make for an effective cross-issue area application. If you can separate these two programs out because it's not a targeted population, or because they're currently already two standalone programs, the chances are that the cross-issue area is really not for you. But at the same time, please prepare some documents in writing for us to respond to if you disagree with that. So that is perfectly okay. The last thing I want to point you to is the scoring rubric, which is a tool developed for our volunteers, but we are giving you access to it as well, so you can really read through and understand, how am I doing in aligning with what their expectations are for each of these sections of the application. Just remember, our scoring timeline, our scoring scale is from a 0 to 10, with 5 being effective. So if your program scores a 50%, most likely it is effective. It just might not have been as competitive as other programs within the area you're applying. And then there are certain sections that can only have a 5, such as a budget, your client demographic forms, and your logic model measurement forms. Please always have, and these are some helpful hints and tips, please have someone who is not familiar with your program read your application in order to help find holes within your application. While our issue area volunteers are experts, they are not experts in your program, so they will not be filling in missed information if you have some of that. So that is important to make sure someone else can help find any missed information if there is any. Don't copy and paste from one section of the application to another. Make sure you are reframing your statements within the application. Don't have our volunteers, don't put in your application, refer back to X, Y, and Z. Our volunteers are reading so many applications that if they see that, they most likely will skip over that and not refer back, and you might see a lower score because of that. So please avoid that at all costs. You have 90,000 characters to address the questions adequately. If you are starting to run out of characters in any of the forms, please make sure you come to a grant lab so we can help you out. That will ensure that we can help really tighten up the information you're providing to the volunteers, or we can provide you prompting questions of things that may have been missed or that could be rearranged, if you will. At this time, that is all I have. We hope to see you at our next grant lab, and don't forget our webinars will go live tomorrow through the procedure and key dates file on the website.